All right, we're now live here at Shiloh Vein Anesthetics Institute. We are filming the second part of a procedure that has already been started. The first part is the dermaplaning, which our amazing esthetician Lisa's already done, and now we are going to be applying a acid micropeel. All right, starting a timer here.
So this is the second step after the dermaplaning, is obviously the first step, which is your physical exfoliation of that top layer of the skin, which I already did to our patient. The second step is putting on a 30% glycolic acid. The skin will show a little bit of erythema, which usually just almost peaks with the sensation of a burning, and it's almost like a pendulum. So as the heat increases, the pendulum swings up, and all of a sudden, slowly, after about 30 seconds to 60 seconds, that pendulum will swing down. So how do you feel, Felice, with that?
It feels a bit spicy, but it's not uncomfortable.
Spicy.
And I give one good coating. It stays on for total of 3 minutes, and then I neutralize it off. Again, this is the second step. It's a corrective phase. Really, really nice peel for an event. Like if you have a wedding, I would say post 48 hours. It's a great peel. Your skin looks amazing, your makeup goes on, your pore size looks smaller, your skin looks really smooth, and it's really hydrated looking. It almost glistens after. And we technically call this a lunchtime peel because there's really no social downtime involved.
And it is lunchtime. How you feeling now, Felice?
I don't feel as much of any tingling as I did in the beginning. It feels pretty much like it neutralizes itself.
Yep. Just as it was described as a pendulum.
So again, 30 seconds swinging up, feeling that heat, feeling a little bit of that spicy tingling, which she was saying, and then all of a sudden it just shuts off and it swings back down the pendulum, and it almost like your skin just feels, again, like normal. You don't feel the heat, you don't feel that tingling sensation.
What's up next?
Next step, we're gonna neutralize it off. With a peel neutralizer, you may increase the tingling a little bit again, and then we water that off, and we finish with a nice healing mask. How's the sensation? Is it basically subsided?
Yeah, pretty much. I mean, I don't really feel much. Small areas it might feel a little bit more tingly. In other areas it's just definitely like turned to less of a sensation.
And you've had this one before, right, Felice?
I've had peels before, yes.
Mm-hmm.
So now I'm neutralizing this off. Again, you might initiate the tingling one more time. Using a soft gauze to get all the peel solution off. Keeping your eyes closed. And again, what's nice about this peel is after the dermaplaning, which is taking that top artificial layer off the skin, and as we age, it's very hard to shed that layer yourselves. So I'm manually doing it for her. Little redness, erythema around the cheek area again. Maybe 30 minutes it will last. Sometimes by the time you leave and after I put on my healing mask, that redness is gone. And then I just cold compress.
This looks so relaxing. I feel like I want to go next. What do you think? Do I have time today? No?
No. Cold compress off, and then the final step will be a phytocorrective mask, which really takes the redness down. It has healing agents to really just calm the skin. moisturizer, and a great, of course, SPF,
Sounds great.
which is your Physical Fusion 50 before you leave. Post peel, 48 hours, no active ingredients on the skin. And then you can go back to your normal daily skincare program.
But that's something that you also help recommend, is that correct, Lisa?
Yes. So basically, this is the first peel of a series of 6, and I specifically say about 2 weeks apart to complete your series of 6. And then you go in a resting phase, which you could still come in and dermaplane, and you could administer a nice healing mask or a very moisturizing treatment to the skin without the acid step. After resting the skin for 3 months, you could go back to another series of 6 acid peels, 2 weeks apart to complete your 1 year.
Excellent. What about having Botox or fillers done in that time frame?
You would want to do it post, you would want to wait at least a week post. Right. You just don't want the fillers to move.
Sure.
This is your phytocorrective mask. It's a lot of plant extracts, very healing, very calming to the skin, as well as hydrating the skin after putting on the acid. And this stays on for a couple of minutes.
How you feeling now, Felice?
Very relaxed.
I thought you were sleeping for a minute.
All these products are basically under the SkinCeuticals, which is under the L'Oreal umbrella. And they're medical grade products that we use to really change the skin and definitely see just an upstart, like you're almost jump starting the skin to really see a difference.
And this is all the various products that we're using here, and we also have obviously things that you can take home with you if you're here that will you can continue to use at home, correct?
Correct.
All right, well, we're going to sign off for now, and I hope you enjoyed this broadcast.